endometriosis affects an estimated 200 million women worldwide. Information and misinformation. I must actually be insane. Hiding in the dark.
25 years.
I'm Amanda Marie Fuller, and I am more than 1 in 10 people who have endometriosis. You're listening to That Endopod, a new podcast where we will discuss all things endometriosis, from hearing the very personal journeys and stories of fellow endo warriors to interviewing experts in the field who can hopefully shed some light on all of the burning questions and answers and facts and myths and information and misinformation and everything regarding endo that's just been hiding in the dark for far too long. Endometriosis is a disease that affects roughly 10% of people born with a uterus. But what is it? What is endo? What is endo? What is endo? What is endometriosis? The Oxford Dictionary defines endometriosis as a condition resulting from the appearance of endometrial tissue outside of the uterus and causing pelvic pain. Okay, I gotta stop right there. Wow, Oxford, that's quite the truncated definition. Causing pelvic pain. Okay, I wish that's all that it was. Truly, I truly wish that's all that endo was. Anyway, let's talk about the origin of the word endometriosis, which I actually kind of like. I at least like the feeling of it. So from the early 20th century, we have endo, meaning within. And then we have the Greek mitra, meaning womb. And then Isis, which is a word that names inflammatory diseases. So I do like the sound of it, from within the womb, an inflammatory disease, except that it's completely wrong. I mean, even when you break down the word itself, it's wrong, because endometriosis is not a disease that is from within the womb. It's quite literally the opposite of that. It's when endometrial tissue grows outside of the uterus, outside of the womb, and then affects the entire rest of the body. But we'll get into that. Don't worry. I don't know. I still think it has a nice ring to it, but whatever. Let's look at some other definitions we have. We'll just go with the next one in the Google search, which is from the Mayo Clinic. Let's see. The Mayo Clinic says, endometriosis is an often painful disorder in which tissue similar to the tissue that normally lines the inside of your uterus, the endometrium, grows outside your uterus. Endometriosis most commonly involves your ovaries, fallopian tubes, and the tissues lining your pelvis. Rarely, endometrial-like tissue can be found beyond the area where the pelvic organs are located. What? For real? Oh, I don't know about that. I think I might want to contest that one, Mayo Clinic. But let's continue. With endometriosis, the endometrial-like tissue acts as endometrial tissue would. It thickens, breaks down, and bleeds with each menstrual cycle. But because this tissue has no way to exit your body, it becomes trapped. When endometriosis involves ovaries, cysts called endometriomas may form. Surrounding tissue can become irritated, eventually developing scar tissue and adhesions. Bands of fibrous tissue that can cause pelvic tissue and organs to stick to each other. All right, I can get down with that. That seems pretty accurate. Endometriosis can cause pain, sometimes severe, especially during menstrual periods. Fertility problems may also develop. Fortunately, effective treatments are available. Ooh, Mayo Clinic. Oh, I don't know about this. This definitely gives me pause. But once again, let's just move on. Instead of continuing to go down this rabbit hole of definitions of endometriosis that you can find on the Google, although I do implore you to go down that rabbit hole. It is fascinating. It is mainly fascinating due to the fact of how redundant it is in its ambiguity and simplicity and misinformation, especially coming from someone who has endometriosis. Fascinating or infuriating, I don't know, dealer's choice on that one. You'll just find a lot of the same. So I'm going to skip all that, and I'm just going to jump to what you can find on the EndoFound website. Now, full disclaimer here, I am somewhat involved in EndoFound. It's an incredible organization that is fighting for the advocacy of endometriosis. I became supportive of them last year when I had my surgery with the founder of EndoFound, Dr. Sechkin, and his colleague, Dr. Chu, who are incredible, and I am so grateful for. Thank you, guys. So I do fully support the EndoFound website and foundation. I'm including this because after coming out of this very deep dive of what is the definition of endometriosis on the Google, it is the first and only thing that I found that even comes close to possibly actually somewhat describing in a more accurate way what I feel is a proper definition of endometriosis. So here are some excerpts of what they have to say. Endometriosis is a menstruation disease. It occurs when tissue similar to the interior lining of the uterus or endometrium mistakenly migrates and implants in areas outside of the uterus, primarily in the pelvic region. These implants respond to the monthly fluctuations of women's hormones, estrogen and progesterone, during her menstrual cycle. During this cycle, estrogen serves like food for the implants, causing them to grow. In transgender men, these changes can begin before they undergo hormonal transition. These implants are endometriosis, menstrual period tissue literally stuck inside a woman's body that clings like a leech to whatever organs it can find. That feels more accurate. When the body's immune system and clearance are not adequate, it can grow. Endometriosis then causes inflammation, which can lead to adhesions, scarring, internal bleeding, bowel or urinary dysfunction, constipation, painful intercourse, or infertility. The physical pain can be severe, which can lead to psychological distress. It's a combination that, in many ways, can ruin a woman's life. Thanks, EndoFound. I feel seen. I feel heard. Endometriosis affects an estimated 200 million women worldwide and approximately 1 in 10 women in the U.S. It strikes women from all racial, ethnic, and socioeconomic backgrounds. There is no known cause of the disease and no cure. A woman's pain or other symptoms are often dismissed as part of being a woman or misdiagnosed. This often causes a delay of a decade or more in a woman receiving the proper diagnosis of endometriosis. And then it goes into, where it can be found, which let me quickly list off some of those. Female reproductive organs, including the uterus, fallopian tubes, ovaries, uterosacral ligaments, and peritoneum. I hope I'm saying all those right. I'm not a doctor. It can also attack the bowel, bladder, intestines, appendix, rectum, leg nerves, seep into deep spaces between the bladder, rectum, uterus, and or vagina. And in rare cases can spread from the pelvic region into the kidneys, lungs, diaphragm, or brain. Holy shit, guys. Okay. First of all, thank you. Thank you, EndoFound. That was really helpful. It's a nice opening disclaimer of what endometriosis is and can be. Here's the thing. We are still learning. We are still figuring this shit out because endometriosis also happens to have been barely researched and barely funded for research for like its entire history of the universe up until now, which we're starting to make a little tiny bit of headway in there, but it is still incredibly under-researched and underfunded. So let's change that. Enough is enough, which is also one of the reasons why, here we go, I truly believe that it is way more than 1 in 10. I believe that because if we were actually break down how under-researched and how misdiagnosed, underdiagnosed, or just quite literally has not been diagnosed, like women who are still seeking that diagnosis that takes on average 10 years, in my case, 25 years, then don't we have to take that into account of the statistics that we're basing that number off of? It just feels like math to me. It just feels like common sense, logical shit. But I do look forward to breaking down that theory with actual experts. This is a good time to include that I am speaking on this disease as just a person who has it and is still trying to figure out what it is, how to navigate it, how to live with it, how to treat it, all of that stuff. I am in no way coming from a point of view of an expert. If anything, it is quite the opposite. I am a sponge. I want to absorb and learn every possible thing that I can so I can finally take a hold of my life. So that's what this podcast is for. So everything that I say, I could be completely wrong on some of this stuff. And if that's the case, please come at me. Let's talk about it. Let's start this dialogue. Inform me and let's inform each other. That's the whole point of this. So I just wanted to put that out there. But that being said, I do think that my theory might be onto something when it comes to that. I think it's probably double. But that's just my opinion. Let's get into some of the symptoms because I feel like that's a necessary thing to do before I kind of segue into my own personal journey and history with the disease. When talking about symptoms, it's funny actually in preparing for this episode, I wrote down look for a proper analogy or like a really good analogy for what the symptoms of endometriosis can look like, because they can be so vast and so random or seemingly random, and it can be any combination of so many things and all of that, but they all stem from this root cause of this disease. So I even asked my husband, I was like, can you think of like an analogy for this? And I realized like, I don't know that there is one. I don't know of anything else that so specifically would represent what the symptoms of endometriosis can look like. Maybe the symptoms of endometriosis will be its own analogy for other things. So because symptoms of endometriosis can range from just like a more painful than commonly painful period to someone being incapacitated from pain and just unable to function from the pain of the period, or also like digestive pain, bowel pain, sciatica pain, nerve pain, numbness, headaches, migraines, you name it. The range of symptoms is so expansive that it's almost impossible to like nail down what the cause and the root of those symptoms or any version or combination of said symptoms can be. Oftentimes, it's one of the reasons why it's so misdiagnosed, is because those symptoms can lead to so many other things without any actual proper evidence of endometriosis or way to know that it's endometriosis besides the symptoms and or just having the laparoscopic surgery, which is in fact the only actual proper way to diagnose it. So that, and combined with the fact that it is maybe the least covered disease in medical school. So most doctors, and I know this for a fact from personal experience, or at least up until now, maybe things are starting to change, God, please. But most doctors have never even heard of the word endometriosis or just hearing the word for the first time. And so they have no knowledge of it to be able to send you in that direction if you're not an actual specialist of endometriosis. It's not in their training at all. So it makes it nearly impossible for you to get the help that you need. Fun times. So this needs to change. But here's a list of common symptoms. I'm going to go back to the Mayo Clinic because I feel a little bit bad for throwing so much shade on them earlier. And I will say that when you go down this rabbit hole on Google, it's also a lot of the same. Common signs and symptoms of endometriosis include painful periods. Pelvic pain and cramping may begin before and extend several days into a menstrual period. You may also have lower back and abdominal pain. Pain with intercourse, pain during or after sex is common with endometriosis. Pain with bowel movements or urination. You're most likely to experience these symptoms during your menstrual period. Excessive bleeding. You may experience occasional heavy menstrual periods or bleeding between periods. Intermenstrual bleeding. Infertility. Sometimes endometriosis is first diagnosed in those seeking treatment for infertility. Other signs and symptoms, you may experience fatigue, diarrhea, constipation, bloating, or nausea, especially during menstrual periods. Yeah, so there you have it. There's that. Bye-bye, Google. So it's still a pretty basic list, but that's the general gamut. It's hard for me to be able to access this kind of information so easily. I'm grateful that you can, but growing up with endo, this was not available to me, which is why my journey has been so long and so bad. Thank God it's changing. It does illustrate how far we've come. You'll discover in the next hour that I am sharing with you my personal journey, that I might kind of have somewhat of a typical case of endo. I mean, not without a few surprises here and there, of course. But that because none of the doctors that I sought help from, they never even mentioned the word endometriosis, it took me 25 years to get a proper diagnosis. Now, sharing my story or figuring out how I'm going to share my story, it's not been easy, and it's not for reasons that you might think. It's not that I'm apprehensive or fearful of being vulnerable. It's definitely not the case. I've made a living most of my life being vulnerable. I don't scare easily in that department. It's mainly because just trying to get a grasp of what my health journey has been and just get any sort of hold on it so that I can share it has been pretty daunting. Here's the thing. I have an issue with my memory. I'm an actor. I've been an actor my whole life. I have zero issue memorizing script, memorizing lines. I have a visual memory, so typically I can look at anything on a page like once or twice, and then I can recite it back to you. It's kind of like my party trick, my little mini superpower. It's so useful in life, really. No, but it is in my profession, so I'm grateful for that. But in terms of my actual life, there are like giant gaping holes and gaps. I have hardly any memories of my childhood. There are a few, and The rest of it's just kind of like tableaus or visions, but specifics on everything is pretty fuzzy. And I don't typically just like retain events of my life. It's weird. I have friends that can be like, oh, that was 2016. I'm like, what? How could you possibly know that? It's all just a big blur to me. I think a part of this stems from some trauma that I've experienced. I'm not going to get into that because that's a whole different podcast. But there is some trauma from my childhood that I have blocked mostly 100%, which for, just a whole lot of blanks. I'm shooting blanks, guys. You see what I did there? That was like a double entendre because endometriosis causes infertility. So shooting blanks. Get it? Bad joke? Anyways. Okay. Let's get back to the memory thing. My memory is wonky. So in trying to prepare of how I'm going to share my journey with endometriosis once and for all, I'm just afraid that I'm going to like leave out a whole bunch of stuff that's relevant or not remember stuff right. Anyways, you get the idea. But I also think that besides the trauma thing with my memory, this might also be a consequence of chronic illness and chronic pain. Because I think another reason my memory is so wonky with my health journey is because I've been chronically ill my entire life. And with chronic pain and chronic illness comes depression, fatigue, memory loss, a whole bunch of things that otherwise just don't promote a healthy life lived of potency and accuracy, or just having a full-blown memory of it. So that makes this difficult. And in my case, where I know that the way that I deal with trauma is just by blocking it out, it kind of adds up that a lot of this is hard for me to remember. So that's my disclaimer. I guess let's start from the beginning. What do I remember? The early days are kind of the fuzziest. I don't remember my first period very well. I don't remember the first time I saw blood in my underwear or feeling humiliated at school because of my big dark secret. I don't remember any version of the story that you so often associate with a girl getting her period for the first time. I do remember how painful it was to put in a tampon for the first time. Like it was yesterday. Like excruciating. Is that normal? Who knows? Maybe it's just that traumatic to put a plastic applicator up your hoo-ha before you've even kissed a boy. But I remember the pain as if it's happening right now. Maybe that's because my young body was already telling me something was very, very wrong. Maybe not. I'll never know. What I do know is that I started menstruating around the age of 11, and things weren't normal right outside the gate. Immediately, my periods were very, very heavy and very painful. But they were also quite literally abnormal in the sense that my cycle was all over the place. I would bleed for weeks on end, and then I would skip months. There was no pattern to it whatsoever, no rhyme or reason, no connection to anything else. Just completely unpredictable, which was really fun to deal with as a young blossoming child actor. Never knowing if I was going to randomly like bleed through my wardrobe or have an accident on set with all eyes on me and cameras. No wonder I suffer from anxiety as well. So after about a year of this abnormal cycle situation, the gyno that I had at the time put me on birth control. I was 12. They put me on it to regulate my cycle so that I could have more of a regular cycle. To my recollection, that was the only reason that they put me on it. It wasn't to help with my pain or the heaviness or anything like that, just to regulate it. And it worked more or less. My menstrual cycle became normal. And if I ever went off of it or forgot to take it or whatever, because I was a teenager who had much more important things to deal with than my birth control, it would immediately just go back to being all over the place. It didn't help with the heaviness or the pain, or so I thought. I'll circle back to that. But the pain was still extreme and the heaviness was still extreme. And it would oftentimes just put me out of commission. I, of course, was just told that this was normal and just a part of being a woman. And I fully accepted that. I never looked back. It just became my new truth and my new norm of being a woman, and I learned to live with it. I didn't even think to seek treatment to be in less pain. Like, that never even crossed my mind. Just learn how to suffer through it, like I think most people with endometriosis did. And then as far as my reproductive health goes, that was kind of it until my late 20s, early 30s. outside of an abnormal pap that I got from Planned Parenthood once that showed abnormal cells that they thought could be cancerous, but I guess came back okay with further testing. I don't really know, honestly. That's the only conclusion I can draw, considering nothing ever came of it. But yeah, other than that, like nothing really of note in terms of my reproductive health for the next 15 years or so. Just 7 or more days of bleeding buckets every month of my life. You might hear me say that a lot on here, bleeding buckets. It's kind of my go-to description for my life. Meanwhile, I found myself on a really fun roller coaster of other health issues. Things that I was in desperate need to get to the bottom of and just constantly striking out. The thing I remember most from my teenage years is sitting on the can. I remember just spending hours in pain on the toilet. So somewhere in my teenage years, I started to have very disruptive and relentless digestive issues. It became nearly impossible for my body to digest food properly, and almost everything made me sick. Chronic diarrhea with just bouts of random constipation. It basically sums up my entire life of going to the bathroom. My torso would become very bloated, like extremely engorged. And so I started to see a slew of gastroenterologists, who, of course, all diagnosed me with dun 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 IBS. Oh, I hate those words. I hate them. I despise them. Irritable bowel syndrome. I will always despise those words. And not just because they're like gross words, which of course they are, but because since the first time that I was told I have IBS, and then every single time after that, which I couldn't even count, I knew they were wrong. I just knew it in my gut. See what I did there? So I would go on all the diets that they suggested, all the IBS friendly foods and non-friendly foods, and I would follow them to a T, and it would just make everything worse. Like zero relief. I found that when I was on the diets or the food map for IBS, I was even sicker. And then the doctors would just throw up their hands. They would not so subtly imply that I must not be doing the diets or I was lying to them. So they basically gave me 2 options. Either it was all in my head or it was all my fault. I really believe that this is the precipice of the shame that I have surrounding my chronic health issues, why it's taken me so long to push through that shame, like just enough to be able to start talking about it, which is so sad because they were wrong. They were so wrong. Like, spoiler alert, I was right the whole time. My instincts were more reliable than all of the specialists that I went to go see who had years of medical school. Combining all of this with being a young actress, and yes, I specifically say actress. I think being a young actor with female parts is a very distinct experience to being one with male parts. Not that male young actors don't have their own fun treasure chest of challenges and exploitation or just their own microscope. But when you were a young actress, which I was, or at least at that time, I should clarify, this is a while ago. Things are finally changing, or at least moving in the right direction. I still think young actresses these days probably deal with a lot of the stuff I dealt with, maybe just more under the radar, or it's like covered up in a different way. But that's another whole other podcast. I'm going to start like 10 podcasts after this because there's so much to talk about. But so you have to remember, okay, so I started working when I was 8 years old. So let's say like 1997 to 2015, like that was the big chunk of the time that I dealt with a lot of these things that I'm about to discuss. Not that I don't still deal with them, but it's definitely different now that I'm older. But for that time period, it was before the whole body positivity movement. It was before any diversity or inclusion whatsoever, or any and all of the things that are finally starting to make headway in our industry, which I applaud so immensely, but also have a very hard time wrapping my head around because I was just brought up in such a vastly different environment. I was under such a microscope. To be thin, to be skinny. The thinner that I was or that I could be, the more successful I would be, or I was told I could be. And at the same time, I was like a blonde, blue-eyed young lady, growing up. So they were trying to put me in the category of Barbie or leading lady or cheerleader type, which yes, I played a lot of cheerleaders. I ended up playing a lot of these roles. That's true when I was growing up, because I think I aired on that side of the fence a little bit maybe, but I was constantly told to work on my appearance from as far back as I can remember. Even before I was explicitly told those things, I was hyper aware that what I looked like and my weight was in direct correlation to my dreams coming true. Poor little Amanda. I wish I could go back and just tell her all of the truths, but I digress. And then when I went through puberty and became a teenager and everything developed and all that, I took after my grandma, my beautiful, beautiful grandma, who was very curvy. I was considered voluptuous, I would say, to put it kindly. That's not the word that they all used, but that's the word that I will use. Now, in human real life, I would be considered tiny. But by industry standards, I needed to lose weight. I think I was a size 2 to a size 6 during this time period. We're talking over the course of 10, 15 years. So it really is bizarrely sickening, because I remember the first time that I had to wear a size 6, which meant that I had gained weight because my size was larger than it usually was. And I was mortified. I mean, I was crushed because I thought that my career was over. So all that to say, being a perfectly normal sized teenage girl, I was constantly being told that I wasn't skinny enough. So having a health issue that caused immense bloating and getting sick after every time that you ate and having to run to the bathroom all the time, combined with all this pressure that I was under to be thin, it was pretty lethal for me. I first started battling with severe depression during my teenage years, and I could safely say that it probably stemmed from all of this. Because outside of that and some other childhood trauma that I endured, everything in my life was fucking great. I had an incredibly supportive family. I was a straight A student. I had a career. I was a professional actor doing the thing that I'd always dreamed of doing at a young age. What more could I have wanted? My life was a fucking dream, except it wasn't. I remember being locked in my bedroom for hours, cutting myself, experimenting with self-harm in any way that I could, contemplating suicide, journaling, so much journaling. Thank God for journaling. I think that saved my life. I don't want to make this so dark, but the truth is, that shit's real. And I remember that mental agony like it was yesterday. So this, along with my health just feeling like it was completely against me with zero answers that made any sense, it was tough. And it probably also had something to do with the fact that I was dealing with a chronic illness that I had no actual connection to, that I could gain a hold of, that my body was fighting this disease without having any idea that it was fighting a disease. That's a lot, right? We can unpack all that even more in the future. But I will also say that I was lucky in the sense that I never really dealt with any of the typical eating disorders. It never led to that for me. I say typical because I don't claim to not have a disordered relationship with food or relationship to eating, because I definitely do. But it never manifested into anorexia or bulimia or anything like that. I was a people pleaser. I'm a recovering perfectionist and I'm an extreme people pleaser. So I think that stems from being an actor in the industry and always having to have your identity be good enough for somebody else in order to get work. It's just kind of ingrained in me to make people happy and to put other people's opinions before mine or feelings before mine. I'm still working on that to this day. It's not easy, but I was the golden child of the family, so to speak. So I could never have an obvious eating disorder, because that would make me a problem for somebody else. It's interesting. And there's just no way I would ever allow myself to be a problem for my parents or anything. I was working so hard to be the opposite of that and just gain their approval and be perfect for them. So I think I say all of that to include how important this part of the journey of having endometriosis was for me, just in terms of endobelly and being bloated. At the time, I had no idea what it was, but being so bloated all of the time. And it's uncomfortable and it's painful and all of that, but also My entire identity was at risk, my entire livelihood, everything that I had worked relentlessly to accomplish. I mean, like I said, I was a straight A student through all this, working pretty full time as a child actor. So I would be up to like 2 a.m. doing papers and homework and memorizing lines for whatever auditions I had the next day to make sure that my grades were up, because my parents were very, very good parents in the sense that they made an ultimatum, like, and it very clear from the very beginning, that if I were to pursue an acting career at such a young age, that there was a couple criteria, one of them being I had to maintain, very, very, very good grades and just keep my head on straight and not become an asshole. So I applaud them for that. So I could talk about this, my weight with the industry and my body dysmorphia, which I still suffer to this day. Don't think it will ever go away. I could talk about it for hours, and it is relevant, but you get the idea. So let's get back on track. What do I remember? I remember being 18 and falling into a swamp. So when I was around 18, I did a short film for AFI. And we were shooting at this lake. I wouldn't call it a lake. I would definitely call it a swamp. In the Santa Clarita Mountains, it was a place that was often used for filming. And my character is on the dock in one scene, and I fell into the lake or the swamp. And the reason I mention this is because shortly after that, I got very, very, very ill, like even for me, like much more ill than I was used to. I started vomiting and I couldn't hold any food down, which was not something that I was used to doing. I usually had a problem the other way around, and I hated vomiting. To this day, will do anything in my power not to throw up. So this was an excruciating chapter. And I don't know that the illness after that incident of falling into the swamp is connected, but my mom seems to think that it might be and has always thought that it was. So I thought I would include that. So I was very, very ill, and they did a whole round of tests. I started to lose weight like very rapidly because I could barely eat anything. I don't think I was eating at all, and not by choice, but just because I couldn't. And they tested me for mono among a slew of other things, and it all came back negative. And they were like, I don't know, what's wrong with you? Who knows? It could be anything. Probably in your head. But for real, they couldn't figure it out. And I remember during this time, I went on my first trip to New York with my mom. We were looking at colleges, and I was so ill. And I remember vividly like walking the streets of New York, and I just couldn't do it because the smells, not like the garbage smells and the smells of New York in that sense, but like the smells of the street vendors and, the nuts and things that they cook in those little street carts would make me insanely nauseous and, do some fun things that nobody wanted to see. So that was very hard, which is totally ironic because New York, as of now, is my second home. And sometimes I even consider it my first home. And that trip, believe it or not, like I still fell in love with New York, but even while experiencing that. But it was unfortunate, to say the least. So yeah, months went by and they just didn't know what to make of any of it. And I think they eventually were like, well, let's do all the tests again and let's test for mono again. And this time it came back positive, which they were like shocked by because I wasn't presenting typical symptoms for mono. It will generally be like flu-like symptoms, sore throat, lymph nodes, swollen glands, all that stuff. And I didn't really have any of those. But apparently it just attacked my digestive system instead, which kind of adds up because of all the other digestive issues I had because of the endometriosis. But anyways, I also don't know if this is directly correlated to endometriosis and having endometriosis outside of the fact that endo was an inflammatory disease. And as I read before from the information from EndoFound, if you have a compromised immune system, it tends to worsen. And from this point in my life, things just got worse and worse and worse. And I think that has a lot to do with my immune system and potentially having mono at that time. I think ever since that point, my immune system has just never been the same, which is probably why I get like cyclical strep throat. If I get a cold, it is not good. I can't just have allergies or get a cold. It's always like a whole freaking thing. It usually always turns into strep. So all of that stuff I think is probably connected to having mono at that time. I have to include another anecdote here. A very good illustration of the whole weight thing and the industry that I dealt with, because at this time I was also doing a play. I was producing my first play on my own, and I was starring in the play, and I was very, very proud of it. But I was also very, very ill and had lost like at least 20 pounds. Like, I think, so my typical weight at that time in my life was like 120, 125 pounds. And at this point I was under 100 pounds, maybe like 95 pounds. So for me, it was just bone thin. And my manager at the time came to see me in the play. And I'll never forget. Afterwards, all she had to say, which, mind you, I gave a riveting performance. I was doing Sam Shepard, Cowboy Mouth, and Savage Love, which we turned the poems into a one-act play, and it was very cool and whatever. But it was a very, very impressive performance, if I do say so myself. But all she had to say was, "Look at you! Finally, finally! This is what you need to look like. You're finally at the weight that you should be." And I just like died inside, because here I thought, at this time I still hadn't gotten any sort of results back for the mono, and so they had no idea what was wrong with me. So I thought maybe I had some rare disease that they couldn't detect, and I thought that I might actually be like dying, and I was terrified and barely able to get through performing the show. I was so weak and so ill, and here she was saying to me that this is what you should look like, darling. You look good. Anyways, sick, so sick. She was evil, and I'm no longer with her. What else do I remember? I remember sitting at the kitchen table on the set of Last Man Standing, trying everything in my power not to run to the bathroom. This is in 2013. I'm 29 years old now, and the last 10 years or so have been filled with chronic pain, chronic diarrhea, seeing lots and lots of doctors that couldn't help me in any way, shape, or form, and just dealing with it. But also they were filled with me trying to be a working actor. So the forefront of my life was really just trying to get work all the time. And I learned how to put my health stuff on the back burner, let's just say. Here we are in 2013, and I'm on television. I'm on Last Man Standing, and I'm working constantly, and I'm loving it. And we had a very special episode. It was the episode where the peeps of Duck Dynasty guest starred, and it was all very exciting. My parents, who were huge fans of Duck Dynasty, came down from Northern California so that they could meet them and watch the whole thing unfold. And it was a lot of fun to have them on. They're super lovely people. But I was not well, even by my standards. Once again, I remember being in so much pain that I could barely make it to set. I couldn't stand up straight. I couldn't breathe. And in particular, there was this dinner scene at the end of the episode, in typical sitcom fashion, just like the family at the dinner table. And I was doing everything in my power not to run to the bathroom, just to get through the take. I was just sitting there, please say cut, please say cut. Nobody knows what's going on. It's okay. It's okay. Don't show it. Don't show it on your face. Just doing everything in my power not to show the kind of pain that I was in, and just make it through, because God forbid they had to stop filming because of me. I would never allow that. So if you're looking back on that episode and they include any shots of me at the end, I don't know, I haven't seen it. You might be able to detect that I was not myself. But I was in such extreme pain. Like, I'm talking like millions of knives being stabbed into my abdomen kind of pain. And I wasn't on my period or anything like that. So I wasn't like, oh, I'm having a bad period. I didn't know that could potentially be connected to anything like reproductive female organ wise. I was just thinking it was like a gastro episode. But my insides felt so twisted up that I ended up going to the ER afterwards. And thank God my parents were in town because of the whole Duck Dynasty folk, because if it had just been me, I would have never taken myself to the ER. I didn't know how to advocate for my health that way, and I was used to just shoving everything down. So I would have never gone if it weren't for my parents, but my mom gently forced me. She was so worried, and she literally escorted me to the ER. And I remember just sitting on the concrete floor outside of Cedars-Sinai emergency room, curled up into a ball in hysterics, just sobbing hysterically, waiting to be seen. And I was just trying to write it off as like some sort of flu. But the truth is, it had gone on for so long at that point that my mom was really concerned. It wasn't just for the last 24 hours or something that I had been feeling that sick. It had been at least over a week without any fevers or any of the other things that you would associate with having the flu. So she was concerned that something more major was happening, and she was right to be concerned in that regard. What came from that visit, you ask? A whole lot of question marks. A whole lot more question marks. A lot of normal test results. Somehow it did end up turning into them diagnosing me with diverticulitis. Diverticulitis is a condition described as an inflammation or infection of one or more small pouches in the digestive tract. It is more common after the age of 40. Lab results or imaging are often required. The main cause of it's like an infection that develops when a hard piece of stool or undigested food gets trapped in one of the pouches, and that gives bacteria in the stool. Sexy. So basically it's like your intestines supposedly have like these pockets and stuff inside of them. And if like food, or like a lot of people would say at the time, oh, you eat a lot of corn. I'm like, yeah, I love corn. Who doesn't love corn? Corn! Had to, sorry. But corn can easily get caught in these little pouches that you have. But they didn't perform a colonoscopy on me at the ER. And I don't really know how they came to this diagnosis, but they were just like, yeah, you've got diverticulitis. And we're like, okay. And I remember we were all just like, what? Like, this makes no sense. I mean, at least it was an answer. So we took it because, we had zero answers for so many things in my life. But it didn't make any sense. My dad had diverticulitis. Made a lot more sense with him. But because he had diverticulitis, he was like, huh? He didn't even think it made sense, but we just went with it. I didn't really have any other options. And things didn't really get better. I mean, they stabilized after that bout of whatever the heck it was. It was probably just an endo flare or something, now looking back. But it didn't get worse enough for me to seek further treatment at that point or contest that diagnosis. It just kind of stabilized and I moved on. And then let's cut to 2016. I'm 32. Now, I want to again clarify that all of these like gaps in time with my health history, it's not that my pain or my symptoms went away or anything. I just wasn't prioritizing my health. And I ignored it as much as I possibly could because every time that I would seek help, I would just be told the same thing. Either it was in my head, everything is normal, or given a diagnosis that made absolutely no sense with a treatment that didn't help. So what was the point of trying to get help? Believe it or not, it seemed easier for me just to like suck it up and put on a happy face and pretend that everything was normal. I think I really wanted to believe that everything was normal. There's lots of denial with chronic pain. But in 2016, I found myself on a series and I was consistently working on the same show. Hallelujah. So for the first time in my life, I think I was able just to like give myself a little bit more. It was a reality check. Like, okay, this is not normal. Take care of yourself a little bit for the first time, Amanda. So I got a fancy referral from a fancy famous friend to go see a fancy doctor, this GI in Beverly Hills, California, who is one of the best. And I proceeded to stump even him. He listened and he really wanted to help. So he did all the tests he could think of. And he had ordered a colonoscopy, but we had to put that on hold because a couple of the tests came back positive. One of them being SIBO. SIBO is a small intestinal bacterial overgrowth. So much bacteria, man. It's defined as the presence of excessive bacteria in the small intestine. So, yeah, I mean, it's frequently implicated as a cause of chronic diarrhea and malabsorption. Patients with SIBO may also suffer from unintentional weight loss, nutritional deficiencies, and osteoporosis. Ironically, the opposite was happening with me in terms of weight. Around this time, I started to gain weight unexplainably. Not like a ton yet, but a little bit. So the underweight thing certainly wasn't an issue with me. But it's another bacterial overgrowth thing. Fascinating. He wasn't too concerned about that. There was a medication I think he put me on. But then it turns out I also tested positive for C. diff. C. diff is short for C. diff colitis. It's inflammation of the colon caused by the bacterial Clostridium difficile. Clostridium difficile colitis. My days on Grey's Anatomy aren't serving me well right now. Results from disruption of normal healthy bacteria in the colon, often from antibiotics. C. difficile can also be transmitted from person to person by spores. It can cause severe damage to the colon and even be fatal. Yeah, it's pretty darn serious. It's an infectious disease. Diarrhea, belly pain, fever are the most common symptoms. And I remember at the time, once again, being like, what the? Like, what? I'm a clean person. How did I get an infectious disease? I was at the time in a committed relationship, like all that to say I was only being intimate with one person and he was a very clean, healthy person. He didn't have C. diff. None of it made any sense. But lo and behold, that's what I had, I guess. It was very clear that I had it. So we treated it, or at least we proceeded to try and treat it. It took 3 different rounds of antibiotics to get it out of my system. I'm talking, I was on antibiotics for months because, do the first round of one kind, that's 10 days, and then another round of another kind, that's another 10, 14 days. The GI was just like, what in the world? What is happening with you? So going through all those antibiotics was its own version of hell. Needless to say, I was ecstatic when it was finally out of my system, even though that meant that now I was cleared for the colonoscopy and endoscopy. Now, having all of these different bacterial issues combined with how much pain I was in, I mean, I'm not just talking like, oh, I have diarrhea all the time. TMI, trigger warning. Trigger warning, too much information. But let's get real about it. I would sit on the toilet for up to an hour, sometimes even hours on end, screaming in pain. Crying in pain, obviously, but also like screaming like I'm in a horror film. Not a good one. The best way I can describe the feeling is that it felt like my intestines were all tied up in knots. Like one giant knot comprised of a whole bunch of tiny little knots, just like completely tied up. And nothing could get through. And my body trying to push things through was torture. So going into this colonoscopy, I was certain he was going to find something, like something serious, maybe Crohn's disease or, I don't know, something that nobody had looked into before somehow. Or at the very least, validate the diverticulitis diagnosis that I had gotten years before, because that is something that most certainly shows up in a colonoscopy. But the colonoscopy and the endoscopy came back perfectly clear. Clean as a whistle. Beautiful colon. Beautiful intestines. Everything just looks beautiful. I mean, I remember looking at the footage and being like, that's not my insides. There's no way that is a picture of what's happening inside my body. Like, I must be crazy. Like, all these doctors are telling me it's in my head. I'm crazy. I must actually be insane, because there's absolutely no way that represents what I am feeling and what I'm going through. It was devastating. I mean, I remember this doctor looking me straight in the eye and just being like, you're a mystery case. And he wanted to help. Like, he wanted nothing but to be able to help me. I think he actually was one of the few that believed me. But there was nothing he could do. He had no answers. So that was a shocker, and once again put me right back at square one, at ground zero, so to speak. 0 answers. 0 leads. Having no idea what was possibly wrong with me or how to treat it. And at this point in my life, I've done every cleanse you can imagine. I've followed every possible nutritional diet. I've tried everything holistic. I've done all the things that could possibly help all these symptoms, and nothing works. The only thing that would make me feel somewhat normal is just eating potatoes, which obviously wasn't good for my figure. So that's fun. And no disrespect to him. I mean, he's a very, very good gastroenterologist. I still think he's one of the best. But he had no way of knowing. He wasn't educated in endometriosis. He didn't know to point me in that direction. I don't blame him. But I do blame the system. What else do I remember? I remember lying down in my husband's lap, boyfriend at the time, on the couch watching TV, wondering if I was dying because my heart was beating out of my chest so much and my heart rate was so fast for no reason whatsoever. In 2017, a whole new symptom developed. Woohoo! Heart palpitations. It just randomly started happening where at the end of almost every day, we would have had dinner or watching TV in like quite possibly the most relaxed state that I could be in. And my heart would just go insane. I got like the heart rate app and my heartbeat would be anywhere from like 120 to 200 beats per minute. I mean, it was so ridiculous. And it just felt like it was boom, 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 like just diving out of my chest. And I could feel every pulse in my body, like all the different pulses in the different parts of my body, your wrist, your ankle, your neck, all the things. Like, whoa. And this is at rest. So I ended up seeing a cardiologist and he did all the tests that he could do and everything came back normal. And this is something I struggle with to this day. The heart palpitations still come up every once in a while. It's not as consistent as it was then and not as intensely and always without any change to my diet or exercise routine, just randomly. And this led to a lot of people in my life suggesting that I might just be suffering from anxiety, which, yeah, like kind of adds up, right? So let's talk about that for a minute. Granted, I've lived a very stressful life. Like it's not the most common thing to live your childhood as a full-time working professional while also getting straight A's and trying to have a social life and all that. Like it's a lot. And I loved it. I wouldn't have had it any other way. That's what I made for myself. And it became kind of my norm. I even thrived off of it. So hearing the word anxiety at this point in my life, I don't know, it made me roll my eyes quite a bit. It was kind of laughable to me. Now, if you're to ask me now, I'd completely flip the script. I 100% disagree with myself back then and realized that that reaction was pretty ignorant and that I was just being negligent to myself or in denial or unaware. But I definitely deal with anxiety. I just don't deal with it in a typical way or what I would perceive as a typical form of anxiety. What I've come to realize and accept now is that my anxiety just presents itself in a different way. My body deals with it in a different way and it shows it in a different way, which makes sense considering my history. For instance, one point I was in the ER, this is a few years ago, for something, and they gave me fluids, just like typical fluids to hydrate you, like the saline drip or whatever that they give you that I'd had like a million times before. Every time I've gone to the ER, I've gotten fluids. Don't have an allergic reaction to them. I've never had any reaction whatsoever to them outside of becoming hydrated. But this time was different. This time I felt like I became paralyzed. It's crazy. I can't even believe I'm admitting this out loud, but it truly felt like I became paralyzed. I know that sounds dramatic, and trust me, it was very dramatic. My best friend who was with me, like, I don't even know if she fully was able to believe me because it was so ridiculous. But for a good, few hours, I couldn't feel my legs. I couldn't feel my arms. I couldn't lift my fingers or wiggle my toes. I had no control over my body. It was from shoulders down, just completely detached and could not feel it and could not control it. It was terrifying. Now, obviously, I wasn't paralyzed, but I felt like I was paralyzed. I think the ER doctors thought I was just making it up, which I don't blame them for doing. And my best friend at the time said something like, maybe you're having an anxiety attack. And I still have a hard time accepting that because it was such a physical, visceral, factual experience for me that to think that my mind could have caused something like that and lost that kind of control. Because I remember at the time talking myself down, I couldn't move my body. So even though I was freaking out inside, I was also trying to meditate my way through it. You can feel your body. Your body is right there. That is your finger. Obviously, you're okay. I was doing all of the mental charades that one would do to come out of an anxiety attack in case that's what it was, but also just to convince myself that I was okay. And none of it worked. So it's hard for me to accept that. But looking back, I fully wouldn't be surprised if that's what was happening. and that my body just chose like a completely different way to express the anxiety that I was feeling. And especially being someone who is a survivor of sexual trauma and whatnot, I wouldn't be surprised if those things are connected as well. But were the heart palpitations anxiety? Who knows? I'm not sure to this day. We still don't have any answers for that. I feel like this is a good time to mention that at this point in my life, I had also been experiencing pain during sex. I don't remember when that started, but I do know that at this point in my life, it was a thing. It was an issue. So that combined with everything else prompted me to start to try new things. And one of those things was acupuncture. So I went to an acupuncturist that was highly recommended. And I remember at the end of my first session, looking up at this beautiful Asian woman who had her hand on me so gently and just said, I think you need to look into endometriosis. Ta-da! Leave it to Eastern medicine, man. First time in my life, any health practitioner of any sort had said that word to me. I think I need to give her a call and thank her. So leaving that appointment, my wheels were turning, and I was like, what? What? And it would be wrong for me not to say that. Like growing up, my mom had mentioned that a couple times. But, you know, coming from your mom, you're like, what is my mom talking about? I've never heard of this thing before. Endo what? It's such a weird, bizarre word. And it was nowhere else. But she, for some reason, had some sort of radar on it. And with the struggle that I had with my periods all the time, she had mentioned it to me before. And I'm obsessed with Marilyn Monroe and her life, and had read in her books that she suffered from endometriosis. And so I knew of the word because of that as well. But it was never something outside of my mom mentioning it to me that was presented as a possibility of what could be causing my health issues. So this acupuncturist saying it to me just like opened everything up. I was like, okay, there's that word again. What the heck is that about? Let me look into it. So I found a new OBGYN so that I could look more into this endometriosis thing and get like proper testing and really get to the bottom of that possibility. She predicted that I had PCOS, which I probably do. Let's be real. PCOS is polycystic ovarian syndrome, and this made sense with everything that I was showing up with. And she recommended that I go off the pill. Now, I had gone off the pill once before in my mid-20s, and the results of that were not to be desired. I ended up getting adult onset acne as a reaction to going off of the pill. It was so bad that my agents dropped me. They quite literally were like, yeah, we can't get you work with your skin so bad. I mean, come on. It's BS, like terrible move on my agent's part. Not cool, dude. But it was really bad. And just in terms of my own self-esteem, like I couldn't leave the house. It was so bad. I would cry every time I would look in the mirror. I mean, I still have scars everywhere from it to this day. And I tried everything. I tried other diets, cleanses, all the things to clear up my skin without going back on the pill. But I ended up just going back on it because nothing else worked. And I was desperate to continue to work as an actor. And so I felt like I had no choice. So that had happened in my mid-20s. And here we are. I'm in my early 30s, and this OB/GYN is suggesting that I go off of my hormonal contraception. And despite the fear that my skin might get bad again, I was like, all right, I'm game. Like, let's do this. I want to know what my hormones are doing when I'm not on this pill, right? Or the ring at the time. I think I was on the ring at the time. And so I was all for it. So I went off the pill, but she checked my hormones before. And these were the results. They came back pretty abnormal. Lo and behold, let me read the email that she sent. Dear Amanda, your blood tests showed very low estrogen and progesterone levels, very low FSH and LH hormones, showing prolonged suppression of your ovarian function from contraception. Your thyroid and testosterone levels were normal. Please stop the birth control ring and schedule your ultrasound with me so we can evaluate you further and make recommendations to correct this. So I went off the ring. Now, I should also mention that at this point, I had experienced quite a significant amount of weight gain. Like a lot. I'd gained a lot of weight in a very short period of time. I think it was 50 pounds within a few months. So I was also what the heck is that about? Because there was no change to my lifestyle or anything. If anything, I was on a TV show at this point consistently. So I was more aware of keeping my weight at a desirable level. God, it's so sick to even say that, but it's true. This is how I was trained to think. So the weight gain was something I really wanted to get to the bottom of. So getting these hormonal test results back was kind of a relief because it was aha, something is going on. It was the first results I had really ever gotten back besides the C. diff and the SIBO and all the bacterial overgrowth stuff of my intestines that were abnormal in any way. Because I had gotten countless thyroid tests and nothing ever came back abnormal. So at least there was something going on, right? And there was validation of that. But none of these results led to endometriosis, which despite the fact that I ended up seeing another OB because I wasn't happy with her, that was more because I just felt like she wasn't really hearing me. She just kind of pushed the stuff I was going through aside. For instance, after a few months of going off of the pill and I was calling in her office and being I want to retest my hormones. That's what we said we were going to do. She had some excuse as to why we needed to wait longer. And I was enough of this. I'm finding somebody else. But that's besides the point. I do think that maybe one of the reasons she didn't lead me further down the road of looking into endometriosis was because these results didn't indicate endometriosis in any way. If anything, it was kind of the opposite. Usually, high estrogen levels can contribute to endometriosis as well as high progesterone levels. In my case, estrogen and progesterone were super low at this point. Now, having very low FSH levels is also the opposite of what we would expect to be with someone who has endometriosis. The only thing that kind of added up to possibly having endo were the LH levels. The LH levels being very low is something that correlates to having endo, but everything else was the opposite. So I still don't understand that, honestly. But right off the bat, these results don't really help me out much in terms of getting a proper diagnosis. The only thing that did change was that my periods got exponentially worse and worse and worse and worse. So remember earlier when I said that when they put me on the pill when I was 12, it didn't really help with the heaviness of my bleeding or the pain of my periods? I was wrong. So I thought that what I was experiencing was really, really bad, and it was. But going off of the pill this time led me to a new reality of what my pain threshold was. Apparently, being on the pill that whole time was keeping all of my symptoms at bay, even though it didn't feel like it, but it was. It was kind of just putting a filter on them, I guess. And now that filter was definitely ripped off and things became impossible to bear. So leaving that whole experience just kind of left me needing more answers, needing to investigate further. It just didn't feel right. Even the PCOS thing, I was yeah, okay, I have PCOS, that makes sense, but that's not what's going on. There's something else going on. I just knew, So that year I happened to be in New York and I decided to see an endometriosis specialist for the first time. I saw Dr. Kanayama, who is one of the most highly regarded endo specialists. He did a vaginal ultrasound on me, and he concluded that he was 99.9% sure that I had endometriosis. Of course, without being able to give me an actual diagnosis because he didn't perform surgery on me, but he was fairly certain and he was definitely convinced. He said that from the ultrasound, he found that my uterus was tilted so far to the left that it was crushing my left ovary. He found multiple very large fibroids in the ultrasound, other cysts, lots of things going on. But the main concern was that my uterus was just completely being pulled to the left side, just And he also said during that meeting that I would not be able to have kids with the way that my uterus was. Yay. So that was a lot to take in, but also, okay, some relief. Maybe I'm not crazy. And the next step with him would have been to have surgery. At that point in my life, I was working quite a bit and I just couldn't carve out the time to have surgery and allow for the proper recovery time. So I was like, okay, what else can I do to help this? Assuming that this is what it is, being pretty convinced at this point that this is what we're dealing with. And I just tried to deal with it in other ways, but wasn't ready to have the surgery yet. This is the part of the program that I'd like to call the bridge or the montage at the end of Act 2 before Act 3 that just shakes everything up a little bit. It's just this little random interjection of shite. So in the beginning of 2019, I had a brand new wham bam, what the heck is going on, ma'am, kind of symptom. Vertigo. Maybe I should just call this part of the program vertigo. 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 Yeah, so, vertigo. What? I was on set shooting Last Man Standing. We were in the office set and I had my hand on the desk and all of a sudden I thought that the desk had been flipped over by somebody. I thought that somebody went out to the desk and just flipped it on its end and that I went with it. That was my perspective of what happened. I ended up on my arse, of course, so I completely fell over and the whole room went upside down. And what everybody else saw was just me falling down. But what I experienced was the whole world flipping upside down. And the lovely crew that was family to me at that point came rushing to my aid. And everybody was very worried and concerned, as was I. And I was very dizzy. And I couldn't really stand up straight. And everything was all wobbly and wonky. And I had no idea what the heck was going on. Vertigo. So they sent me to the ER. I'm pretty sure that's when I experienced the paralysis feeling from the fluids. I think that was that ER visit. Anyways, the ER basically just did all the main testing to make sure that I was going to survive. And then they sent me to a neurologist. So then I went to a neurologist who had nothing to tell me. They did some sort of testing and basically were just you're fine, which I wasn't. I wasn't in a constant state of vertigo, but for weeks on end, I couldn't drive. My best friend was my chauffeur and basically became my right hand because my husband was in another city working at the time. And so she just came to my aid, thank God, and had to drive me around because we couldn't predict when the world would turn upside down for me and I would fall over. It was absolutely ludicrous. Oh, Lordy, so embarrassing. And then it just kind of dissipated on its own a little bit. And to this day, I experience little episodes, minor micro episodes here and there, and I'll get dizzy or feel faint or something like that. I have no idea if that has anything to do with endometriosis or not, but it did happen. So even though I had seen Dr. Kanayama and he was fairly certain that I had endometriosis, and I was making the assumption that the vertigo maybe potentially had something to do with that, I was also looking in other avenues. And around this time, another friend of mine had mentioned Cushing's disease because of the weight gain that I had had and all of the other random shit. She had read somewhere something about moon face, which I definitely looked like I had moon face at that time. I mean, I always kind of have a moon face. It's just kind of what my face looks like. But at this point, it looked bloated. And I didn't have all of the symptoms of Cushing's disease, but I had enough to be maybe this is what's going on. Maybe it's this and endo. So I went to see an endocrinologist. And Cushing's disease is something that attacks your pituitary gland, your cortisol levels. So it also added up with the stress of my life and the anxiety. I was this wouldn't be too far-fetched, the heart palpitations, all that stuff. So I went to see this endocrinologist and he did a full thing of lab work, blood work. And he came back and was just kind of I don't think you have Cushing's. Although some of the blood test results did come back pointing possibly in that direction, but I guess not significantly enough for him to pursue that. Not really sure. Yeah. But luckily he gave me those test results. And so I was able to dissect them myself and kind of become my own little Google mania. Became a doctor myself. Not really. No disrespect to doctors. But I was trying to investigate some stuff. The hormones that came back were definitely head scratching and some of the other things didn't add up and didn't make sense. And he seemed to just kind of blow over it all. But I was looking at it and I was like, this isn't right. Like, none of this is really normal. So I had that, but he said I was fine. So I just kind of put it in my pocket. And I went to see another endo specialist. This time I was in Los Angeles. So I went to go see Dr. Iris Orbach, who is one of the best. We had a very intense meeting. She examined me. I screamed in pain throughout the examination. I remember my best friend was by my side because my husband was in another town. So my best friend was like holding my hand through it, and I think it scared her. I think my reaction to this doctor putting her fingers inside of me like scared the shit out of my best friend. Sorry, Lindsay, I love you. Thank you for being there for me. Start crying. But I also had like an in-depth conversation with Dr. Buck. And she also concluded, without giving me an actual diagnosis, without having surgery, that she was fairly certain that I had endometriosis and was also suspicious that I had adenomyosis. Adenomyosis? Adenomyosis? Anyone want to jump in and tell me how you actually pronounce that word? I've heard so many different versions, so I'm going to say both. Anyways, and that meeting with her was a milestone for me because Dr. Kanayama, those results definitely opened my eyes and went, oh, okay, there's something to this. This is real. But speaking with Dr. Orbach was the first time that I really felt heard. And she started to help me make all of the connections to everything that I'd ever experienced. All of my random symptoms weren't random to her. They all made sense, and they all were evidence of endometriosis. And this was the first time that I was being told that. It was a big sigh of relief, like, oh, okay, everything is this, you know? My symptoms were being validated for the first time from somebody who not only understood them, but I think could relate to them. And so I'm just eternally grateful to her for that. The next steps would have been for me to pursue surgery or try other specific treatments like pelvic floor therapy, which is what we did. She suggested that before we just jump into surgery, that we try some other things to see if they can help keep things at bay and make things better. I think at the time also I was working full time, so surgery wasn't really an option, but pelvic floor therapy was. So I went to a pelvic floor therapist and I absolutely hated it. Oh, it was so painful. I mean, at this point, like, I could barely even have sex with my husband. I was in so much pain during intercourse. So why on earth would I want to go somewhere where they're putting things up there and moving things around? And oh my gosh, it was so bad. And this is nothing against pelvic floor therapy because I've heard it does wonders. And I still truly believe that it would and will do wonders for me if I can find the right one and do it the right way and actually just like stick to it. But I was not ready for that at the time. And so we were doing that, and then life threw me a curveball. Whew, I wasn't ready. Tune in next week for part 2 of episode 1, where we'll find out what kind of curveball I've had in store. Any guesses?